We are going to evaluate the RAO sternum projection today. I'm not going to go over the lateral because I think it's a fairly uncomplicated projection to view. There's very little anatomy, and there's just not as many questions. The RAO sternum is a right anterior oblique position of the patient. Why do we do an RAO? Well, here's the patient's right side. We're looking at the right part of our screen. This is the position of the patient. The sternum itself is made of very spongy bone, and it is located directly midline of the thoracic vertebrae. So we are unable to get a really good look at it in AP view. By positioning our patient in an RAO position, it shifts the sternum just to the left of the thoracic vertebrae, and it throws it into our nice homogeneous heart shadow, and it gives us some contrast so that we are able to see it better and have it thrown forward on the RAO projection that you see to your left. Looking at the actual skeleton, we've noticed that our patient is in a PA position. We've turned them only 15 to 20 degrees RAO with their right side to the IR. In looking at this image, you can tell that there's not a lot of obliquity in this patient. We don't need a lot. It's very shallow. If you start to oblique the patient too much, the sternum moves or shifts even further outside the heart shadow and further away from the vertebrae, causing it to become more in profile or in a lateral position, and you don't get a good look at this sternal body. Now take a look at the image to the left of your screen. This is what a good RAO sternum should look like, and this image is courtesy of Kansas University's Medical College. If you look here, oops, grab my pen again, sorry guys. There is the left clavicle. Here is the right clavicle. And if you look slightly below, you're going to see the manubrium, right? Also, if you're going to follow that down this way, you'll see a slight translucent area here, and this is going to be your sternal angle. Now, the body of the sternum is going to have this sawtooth look to it. You can follow it through here. And this is where the costochondro cartilage is going to articulate with the sternum. Okay. And of course, the bottom part of the sternum, you are looking at the xiphoid process or xiphoid tip. That's basic sternum anatomy. Other anatomy you're going to see on here, of course, is ribs. There's first, second, third, and so on and so forth. A good positioned RAO sternum, you will see the sternum laying adjacent to the vertebrae. If vertebral bodies start to superimpose this sternal body or superimpose the manubrium, then you have not obliqued your patient enough. If you start seeing the sternum over here, or if it starts looking more like a lateral sternum, you've obliqued your patient too much. Technique-wise, you should be able to see this sternal body through the heart shadow and through the lung markings and through the overlying ribs. Now let's be honest, okay? I'm not going to kid you. Sternums are extremely difficult to see. If we are looking at a major sternum fracture, more than likely this patient would be experiencing some other thorax difficulties, lung difficulties, and they're going to go straight to CT. Very rarely do we actually do sternums. We can do sternums to look for congenital defects, and that usually consists of a hole here within the sternal body, or we can also look for metastasis that has occurred. keep in mind that you are going to see a sternum on an RAO chest or /and an RAO unilateral rib projection. So how do you tell the difference? Well, typically you are the x-ray tech doing the image, so you know what you've done to your patient. But in the classroom, such as this instance, if we're looking at this image, we automatically know it's an RAO sternum because we've collimated down to size and we're assuming this is a 10 by 12 cassette. If you get into the classroom and you see a 10 by 12 cassette, that is going to be an RAO. I'm not going to give you a RAO sternum on a 14 by 17 that has bilateral oblique ribs on it where you can see the sternum and then expect you to tell me that's an RAO sternum. If you see a 14 by 17 and you've got the entire rib cage above the diaphragm, that could either be a unilateral RAO ribs, or if it includes both sides, the bilateral RAO ribs. I do not expect you to tell me that it's an RAO sternum if it's on a 14 by 17. Typically, again, you are the technologist, you know what you've done. It is hard to walk into a classroom and be able to tell the difference. Also, on RAO ribs, the obliquity is a lot more, so you're going to see your sternum more over here and less right next to the vertebrae. One more thing to note, I want you to look at this marker. This is marked for the anatomical side, not side closest to the IR. Okay, so don't let this left marker throw you off and make you think it is an LAO. It is still very much an RAO. We're just throwing that sternum into the left side of this heart shadow. Okay? If y'all have any questions, you know where to find me. Good luck.